What is CRPS? CRPS, or Complex Regional Pain Syndrome, also known as RSD, Reflex Sympathetic Dystrophy Syndrome, is usually a life-altering condition characterized by chronic, severe pain and commonly accompanied by other symptoms such as swelling and changes in the skin. The condition is often precipitated by some form of trauma, typically of a seemingly minor nature in comparison to the problems that follow. There is no known cure, although experimental treatments continue to be conducted. What causes CRPS? The cause of the syndrome is not clearly known, but revolves about the sympathetic nervous system in some way. Trauma is often cited as a likely cause. It seems like the sympathetic nervous system turns on to help the body deal with the original trauma, but then refuses to turn off. It remains hyperactive. Trauma, even minor trauma, is the major precipitating factor in CRPS. Surgery, fractures, animal bites can all cause CRPS. What areas are affected by CRPS? CRPS can occur in any area of the body, but the most common is one or more of the extremities. What are the symptoms of CRPS? CRPS commonly results in spontaneous pain, often described as a burning or shooting pain, at times reaching unbearable levels. Although the pain usually appears near the area of an injury, the extent of pain typically seems excessive in comparison with the level of any apparent tissue damage in the area of the pain. The pain is often accompanied by swelling, tenderness, increasingly brittle nails, changes in skin color and temperature, and increases in sweating and hair growth in the specifically affected extremity. In some cases, the pain is repeatedly triggered by a light touch of soft clothing or even a breeze brushing across the skin. Decrease in the range of motion of an affected extremity and atrophy of the extremity can result, along with severe osteoporosis and thickening of joints. How painful is CRPS? Unfortunately, CRPS is considered the most painful condition known. The McGill Pain Index rates pain from 0 or no pain to 50, worst possible pain. To give you an idea of how painful CRPS really is, childbirth and the amputation of a finger or toe have a pain rating of between 30 and 40. Chronic back pain and phantom limb pain are rated 30, while a fracture or toothache have a rating of 20. CRPS has a rating of 42. Now consider that CRPS lasts a lot longer than any of the other conditions mentioned, and you will understand why it's often called the suicide disease. Can CRPS spread? Unfortunately, CRPS can spread. Usually it will spread up or down, or left or right. So someone who's experiencing it in her left hand may have it spread to her right hand, or left foot. Very seldomly it will spread diagonally, the right foot in this example. In one study, almost 70% of the participants reported CRPS had spread to more than one area. The majority of the participants could not identify a reason for the spread, while surgery and falls were a distant second and third leading cause. How long does CRPS last? CRPS is considered a permanent condition. Sometimes remission will occur, but usually it is temporary. Although doctors may routinely tell patients in pain that their condition will improve, CRPS is permanent in the majority of patients. The pain may subside for periods of time, but these are simply periods of remission. Any further trauma, including minor surgery or less, can cause a recurrence of pain that is worse than before. What are the treatment options for CRPS? The single most important factor in treatment of CRPS is early diagnosis. As CRPS progresses in severity, it becomes more difficult to treat successfully. Treatments can range from analgesics to lobotomy. If you or someone you know suffers from CRPS due to a car accident, slip and fall, dog bite, or other injury caused by someone else, call us today at 512-246-9191 or fill out the form below.